Keyboard and mouse use creates repetitive strain injuries in your wrists, elbows, and shoulders that often coexist with neck pain, requiring a comprehensive upper extremity approach rather than treating each area in isolation. Most office workers don't realize these conditions are connected through the kinetic chain, how force transmits through your entire arm and shoulder complex. Let's examine specific repetitive strain injury mechanisms. Repetitive movements create cumulative microtrauma. Each keystroke or mouse click is harmless individually, but thousands daily over months and years cause tissue breakdown faster than repair processes can keep up. Static muscle loading during sustained postures, like holding your mouse hand in position, creates constant tension without the relaxation phases muscles need. And here's the kinetic chain connection. Tight shoulders affect wrist position, meaning your neck and shoulder problems directly contribute to developing carpal tunnel syndrome or wrist tendinitis. Common conditions include carpal tunnel syndrome from median nerve compression at the wrist, often from extended wrist postures during typing. Lateral epicondylitis, tennis elbow, frequently develops from excessive mouse use, with pain radiating from the outside of your elbow. Thoracic outlet syndrome occurs when nerves and blood vessels are compressed between your collarbone and first rib, often from poor shoulder positioning during computer work. Ergonomic keyboard and mouse options address these mechanical factors. Split keyboards reduce ulnar deviation, that sideways bending of your wrist when hands angle inward to reach center keys on standard keyboards. Vertical mice reduce forearm pronation, keeping your hand in a more neutral handshake position rather than palm down. Trackballs and trackpads offer alternatives that use different movement patterns, distributing stress across different tissues. Typing technique optimization matters enormously. Touch typing keeps your wrists in neutral position rather than extending back to C keys. Your wrists shouldn't rest on the desk edge during typing. That creates compression on the carpal tunnel. Learn keyboard shortcuts to reduce mouse dependency. Excessive mousing creates repetitive strain in your dominant hand while the other hand remains relatively unstressed. Here's a factor many people don't know. Perimenopause and menopause significantly affect connective tissue, making middle-aged women particularly vulnerable to repetitive strain injuries. Declining estrogen levels affect collagen structure in tendons and ligaments. This isn't about aging generally, it's hormone-sensitive timing where women suddenly develop carpal tunnel syndrome or trigger finger after decades of the same work. Some women find symptoms vary with their menstrual cycle, worsening during specific hormonal phases. Workplace accommodations fall under the Americans with Disabilities Act when repetitive strain injuries become disabling. You can request ergonomic keyboards, alternative input devices, or modified duties. Document your condition with medical records, request accommodations in writing, and understand that employers must provide reasonable accommodations unless they create undue hardship. When to seek occupational medicine evaluation? If symptoms persist despite ergonomic corrections, if you're experiencing numbness or tingling suggesting nerve involvement, if pain interferes with work performance, or if over-the-counter treatments aren't providing relief. Early intervention prevents progression from reversible inflammation to permanent nerve or tendon damage. The integration with neck pain treatment is crucial. You can't successfully treat carpal tunnel syndrome while maintaining the shoulder and neck postures that are pulling your entire arm into poor alignment. Conversely, focusing only on neck pain while ignoring developing wrist problems means you're missing part of the clinical picture. Comprehensive upper extremity assessment examines your entire arm from neck to fingertips as an integrated system. Prevention remains more effective than treatment. Proper ergonomic setup from the beginning, regular breaks allowing tissue recovery, and strengthening exercises for arms and shoulders provide resilience against repetitive strain. But if you're already experiencing symptoms, don't minimize them as just part of computer work. These injuries can become permanently disabling if untreated, affecting your career and daily life. Address them early and comprehensively for the best outcomes.